early signs of kidney disease. You might develop poor appetite, have some dry skin. It might be very shiny, like in the shin area. Frequent urination is one of them. Fatigue, difficult concentration, and puffy eyes.
I gotta go. I've been working, told them please don't hit my phone. I'm in my zone, bruh, just leave me alone. Was on the road, but I swear I'm coming home. Now the drinks on me, I think we need a toast. See, I did it for me. Now my old friends calling, told them nothing's for free. Told me time is money, dog, swear I paid all my fees. I was starving for this game, now my family can eat.
Welcome everyone to the Couple Nurses Podcast. Today we have the Couple News for you with your hosts Matt and myself, Peter. Firstly, if you guys are enjoying us in our video platform, Spotify and YouTube, you can check out our new March launch shirts. Matt's running the Couple Nurses launch number 1, you could say, and I got the number 2 over here for all y'all who watch us on YouTube and Spotify.
That looks smexy.
Looks smexy. A new word right there. Added to the Urban Dictionary right there. But both these shirts are available on couplenurses.shop. We also have couplenurses.com, which houses all of our show notes, our videos, our blog posts, everything Couple Nurses related is going to be on couplenurses.com. We also have a sister site, frontlinewarriorsclub.com as well, which also houses some merch there, some more conscious merch based on some pillars that we have, 5 main pillars on that site. And that's for more of our conscious viewers, you could say. We have blog posts about wellness, mindfulness, just trying to improve yourself physically, mentally, holistically, and spiritually. We also have a project that we're working on launching here shortly called Pronto. Feel free to check it out at prontohealth.com. And this is something that we're working on that's being created to innovate and revolutionize how the healthcare professional looks for jobs, compares jobs, finds jobs for travelers, for staff members, anybody really that's trying to maybe find a different unit or find a different career somewhere else. That's going to be geared towards you, with also some other beneficial stuff on there. But like I said, today's Couple News. Matt, what you got for us?
In today's episode, we're going to talk about kidney health. In the honor of the National Kidney Month, we're going to talk about kidney health and the guide to protecting your kidneys from different disease processes covered on the show. Jam-packed episode. It's going to go back to back with the heart one that we did and blood. This is another jam-packed pathophys anatomy episode.
Yeah, man. For those that don't know, kidneys, they're your filters of your body. They basically pull out all the chemicals and some excess water that's traveling in your blood vessels. You have 2 of them on the rear of your back. You could, or at the back on each side,
right by your ribs.
Right by your ribs. And that's where the kidneys are. That's why sometimes when you get punched over there or poked over there, it kind of hurts a little bit more, because sometimes that's putting a little bit of a pressure on the kidneys, so you might feel it there. But in the hospital, working in the ICU for all these years, we see majority of our patients have either heart disease or kidney disease or both. I would say the probably most common things to fail as you age, I would say, is the heart and the kidneys, probably the primary ones, and then maybe like your liver, your pancreas, and so on and so forth. But renal disease and heart disease are probably the 2 top things we see in the ICU and overall in the hospital, I feel like.
Yeah, especially looking at the statistics here, 1 in 3 American adults are at the risk of developing kidney disease, and that's over 37 million Americans. So it's really important to understand its crucial role in making sure your habits and lifestyle are aligned with that. The kidneys are more than just filtering fluids and waste product to create urine. They also are key producers of different hormones that regulate the balance of your fluids. They remove drugs. They release hormones that activate vitamin D that promotes strong, healthy bones. They produce red blood cells, or the key hormones that control the production of them. You can develop anemia. So there's so many things, and balancing sodium, phosphorus, potassium, you need a good pair of kidneys.
Kidneys are so important. You're born with 2 of them. And that just kind of shows you how important that is. That, and what's also a cool effect, not kidney related, but the liver does regenerate and does, you could say, regrow and can reach its almost max full potential if something happens to it. But kidneys, you have 2 of them. Unfortunately, the kidneys don't have such a good regeneration rate as the liver. So when they tend to get diseased or overworked, or you slowly start getting into those kidney failures or those chronic kidney diseases, it's really hard to get that function back, and not many people do. So there's not much options for people that have severe kidney disease besides like a transplant. Same with the heart. Like if something happens to the heart that's really severe, there's not a whole lot you could do besides maybe give you supportive measures or give you a new heart. Same with the kidneys, with the lungs as well. Liver, you have a little bit of leeway because it does regenerate itself, and you could remove part of it. If it's really necrotic or really damaged, you could remove part of it, and you could still have a very functionable liver, if functionable is a word. But for kidneys, you have two of them. You could live with one kidney. Technically, all you need is one, but of course, that's going to still impact your ability to filter out these toxins and fluid out of your blood.
It also blew my mind how there are certain patients that get an ultrasound because they have a high creatinine, and they find out they have only one kidney, and they've been living with this one kidney for their whole entire lives. Yeah. But jumping into some kidney function, so the smallest functioning unit of the kidney itself, the organ, is called a nephron, and there's about 1 million nephrons in each kidney. What happens is there's tiny blood vessels around this nephron called the glomerulus, which is attached to a tubule. So in the filtration process, blood enters through the glomerulus, gets filtered out, and the remaining of the product gets filtered through the tubule. So whatever the glomerulus collects, that gets either absorbed or reabsorbed based on your chemical needs, and the final product that gets filtered out is urine. Mm-hmm. And a fun fact is that our kidneys filter 200 quarts of blood each day. And out of those 200 quarts, 198 quarts get put back into the body. 2 quarts is produced as this waste product. So that's damn efficient for what it does. And that's why when you drink alcohol, you get dehydrated because you lose the anti-diuretic hormone functionality, and your body just starts pissing out. And you hear the term breaking the seal. There's technically no such thing. You grab alcohol, you drink it. It's only a matter of time before that anti-diuretic hormone stops working and just wasting your water away.
Yep, 100%. There's 8 problems kidney disease can cause. The first one we want to go over here is heart disease. That's probably the major one. So when your blood isn't being filtered properly or filtered enough, what your body does to kind of respond to that poor filtration rate is it increases your blood pressure to push more blood into the kidney so that it could filter, you could say, more blood at a given time. And of course, that's a temporary solution because it's going to clear out that blood a little bit more effectively. But since those kidneys are already damaged, it's just leading to the inevitable, and that's kidney failure. So it's like a short-term solution and a long-term problem. It's going to work short-term wise, but eventually the kidneys aren't going to be able to keep up, and they keep failing, which then tells your body to pump more blood, and then your heart gets some strain on it, and it causes heart failure, and it causes heart damage. And it's a vicious cycle. So heart disease could cause renal disease, and at the same time, renal disease could cause heart disease, because we know that we're not just a bunch of moving parts. We're a bunch of moving parts that all move together and fluidly amongst one another. It's not just like one system stays within itself. Each system affects another one. So this is why some of these issues, especially if you talk about heart disease, lung disease, any kind of respiratory disease, kidney disease, liver disease, you're going to see kind of this repetition of, you're also going to see heart disease, you're also going to see this, you're also going to see that, because usually one thing causes another thing, but that same thing can also cause the opposite thing as well.
Yeah, the human body is very synergetic. And along with that, you might develop heart attacks or strokes because you're already at the risk of poor heart disease, not including high blood pressure is another problem that causes kidney disease.
Yeah, because eventually you're at a hypertensive state, but you obviously can't always be at that state. So once you start developing any kind of heart disease or kidney issues, that's going to ultimately impact how efficient your blood flows throughout the body, and that's going to throw you could say, like, the pressure in your vessels out of whack, because it's going to be pumping different pressures, and it's going to lead to these issues in coagulation, where some places the clots are going into form more regularly than other places, and you get into these issues of potential strokes and all that.
Yeah. Another cause that causes a problem of kidney disease is weak bones. So normally your kidneys are able to transform vitamin D to an active usable form. In this process, you cannot develop that, which causes weak bones. Too much parathyroid hormone is then released to keep the calcium levels balanced in the blood. And by this happening, your bones become weaker because they get pulled from the bones. Another problem of that, of kidney damage.
Nerve damage is also one of these top 8 ones you could see. The evidence on why this happens is a little bit still unclear, but people are speculating that it has something to do with dialysis, leading to neuropathy pains and also a decrease in muscle mass. They're saying something with the pressures of dialysis and how it causes people to have maybe some mineral imbalances, and like it does make sense. But if you're thinking about it, if you're having dialysis, if you have poor renal disease, your body isn't functioning as optimum, and it's not perfusing these distal places like your fingertips and your toes properly, because there's always this imbalance of how much pressure should your body have on each vessel and each part of your body, where it's these organs, like these peripheral tissues like your fingertips and toes, they have almost like an inconsistent amount of blood flow. Sometimes they get enough, sometimes they don't, and it's all due to your kidneys, because your body is always going to push the most blood to your vital organs, so your kidney, liver, and all that stuff. That's why, like, when you're cold, your fingertips start to get cold, because all that blood is kind of slowing down and getting circulated more closer proximities like your liver, like your heart, and your lungs. That's why your fingers and toes are always cold first, because your body puts them as less importance. Because you can live without any toes, you can live without any kind of fingers, but you can't live very, very long without a liver or without a lung or without a pancreas, and so on and so forth. So I think it's more of like the pressure issue than anything else.
Yeah.
With why it causes this nerve damage.
Got me wondering about disequilibrium syndrome, but that's more of a whole dialysis take on all the kidney stuff. Another problem with kidney disease is ESRD. So as you know, kidney failure, which leads to getting dialysis, hemo, or peritoneal, and then you have anemia. So when your kidneys are damaged, they produce less erythropoietin, EPO, and this is a hormone that signals the bone marrow, that spongy thing inside your bones, to actually produce red blood cells. So yeah, just breaking down this episode here, the kidneys do so much more than just make urine, and we neglect that.
Yeah, and it's crazy when you have somebody that has pretty bad kidneys and a bad heart, because you're always like thinking, are they fluid overloaded or do they need fluid? Because if they're still making urine, it's interesting to look at, because it's like a roller coaster of urine. One shift they have like 10 an hour, and then next
roller
shift,
coaster of urine.
You know what I'm
so
saying?
Funny.
Because sometimes they pee like barely any, and then next shift you come in and they pee a bunch, and then they become Lasix dependent for a little bit, and then you wean off the sedation. If they had a contract for that CT a couple days prior, that gets filtered through, and now they're making more urine, and it's like, now since they're making all this urine, should we ease up on these fluids? It's always like trying to find a fine balance between like adding fluid to the patient and removing fluid to the patient, because we could do both, and you can almost do it simultaneously. We have a lot of ways to play with the different pressure in your vessels and how much fluid actually goes into your vessels, because like for Lasix is always going to pull fluid out of your vessels, so it's going to make you pee, or sorry, it's going to push fluid into your vessels, so it's going to make you pee. Albumin does the same thing. It pulls fluid out of your tissues into your vessels, and with the goal of having you pee. And compared to giving you fluids, then we put fluids in your vessels, so you can kind of.
You said albumin causes, or it's given for it to pee. Technically, you're not giving albumin to urinate. Yeah.
You're giving albumin to take fluid out of your tissues and put them into your blood vessels.
Yes.
Which technically, if they usually give it to really sick people, but when a normal patient gets albumin, they do tend to pee more, because it takes that fluid out of the tissues and brings it into the vessels. Yes. So it would make
helps osmotic pressure.
Yeah, but we don't give it to people that are usually walkie-talkie very often.
Nephrologists play a crazy role in healthcare, and they're definitely undervalued. And it's
out of respect, like even when we were doing our fit test, they had that kidney model up there, and it's like crazy to look at how the kidney looks, and it always reminds me of those like crazy patterns. I forget what they're called. Like, how there's like those numbers, those sacred numbers. There's like sacred geometry.
Okay.
Is that what it's called, sacred geometry? Like those patterns. Yeah, how how that's if you ever seen psychogeometry and you maybe cut the kidney in half, like the way where you could see the inside more, transverse is it called, transverse shot or something like that. It always looks like there's like this cool geometry there, and same with if you cut a heart, it looks like there's some cool geometry there. Same with the lungs, so it always blows my mind. Not to get off topic here with psychogeometry.
The universe creates things mathematically.
Like a sun, like a what's that? Like a sunflower. It has its cool seeds.
Yeah.
You can eat them.
And the kidneys definitely have been taking a hit with C19, how we try to keep these patients so dry and the creatinine is kind of riding pretty high, but we want them to have a higher creatinine. They have to be drier to help with ARDS, and sometimes the kidneys going with it.
Mm-hmm.
And sometimes C19 causes the kidneys to go because of the disease process or the lack of MAP, and it causes a cascade of things.
Yeah.
And if you have kidney issues, the whole blood pressure issues is wild. Sometimes we couldn't control patients' blood pressure. Sometimes they're hypertensive. All of a sudden, you put a little bit of Cardine or something, they get super hypotensive. It's a crazy balance beam to play, and the kidneys play such a bad role. Oh, but not to get off topic, some risk factors of kidney disease, and they'll go into the different disease processes. 5 main factors to look out for. You have diabetes, high blood pressure, heart disease, family history of kidney failure, diabetes, and obesity. Very common things that we've seen all the time in the workplace. That's just a cascade effect, especially diabetes. Usually people with hypertension, kidney disease that's underlying, or they come in that are severely sick into the ICU. Underlying, they probably have an elevated HbA1c.
Yeah, what's very unfortunate being human is that there is a lot of risk factors for all these like top diseases like heart disease, lung disease, kidney disease, liver disease, all that stuff. But the crazy thing about it is like there's a high amount of risk factors, but these risk factors are the same when you look at all the diseases. Diet, exercise, proper nutrition, healthy lifestyle, decreasing stress. If you could nail all of those, then your chances of gaining heart disease or any of these other diseases that we mentioned before isn't all that high. Of course, you gotta throw in the genetic factor in there, but you can't always blame it on genetics. You gotta take responsibility for your own life too, and you can't say that, hey, the reason I got a heart attack is because my uncle got a heart attack, my dad got a heart attack, his uncle got a heart attack, his dad got a heart attack, but then you're also overweight. So it's not so much that every male in your family had a heart attack, it's that every male in your family had obesity or diabetes or some kind of a heart issue that gave them this MI. You just I guess haven't realized it yet, but there's always time to change.
Definitely. And additional risk factors are being over the age of 60, having a low birth weight, taking NSAIDs because the kidneys filter it out, such as ibuprofen, naproxen, having UTIs, having kidney stones, lupus, and other autoimmune disorders only lead to higher chances of developing the kidney disease. So some disease processes, the first one we have is CKD, chronic kidney disease, and that's defined as having abnormal markers of kidney function that leads to a decrease of kidney function of 3 months and more. So usually the main cause of CKD is hypertension, just like you explained, the problems of that high blood pressure passing through these small little tubules, the small little capillaries. And ultimately what's happening is it's damaging the glomerulus that we talked about that are encapsulated in these blood vessels, and they get scarred and they get stopped working so well. So what happens eventually is we put people on dialysis to do the same job that these glomerulus are doing, these nephrons that were damaged. And what happens is eventually this high blood pressure keeps on running through these little tubules. It gets scarred. It gets less elastic. What else do I have written here? It slowly thickens, causes scarring over time, and eventually these nephrons begin to leak out. So normally albumin, the proteins, they get filtered through. Now the leaks are so big that actually passes into the urine, and when we do our tests or talk about tests a little bit later, albumin is one of those or protein in the urine is one of those key hallmarks of kidney issue.
Yeah. Next one is glomerulonephritis. Glomerulonephritis is an inflammation of the glomeruli causing damage to the filtering part of the kidney, It can occur from infections, drugs, or another disease such as lupus or diabetes. Some symptoms you can watch out for is pink or cola-colored urine, red blood cells in the urine, foamy urine, and also protein in the urine and fluid retention. This is more of like an acute kind of issue. It's not like a chronic issue. You could say it's majority you could find glomerulonephritis due to some kind of infection. Most of the time, it's usually always due to infection, either like a really bad UTI that's just traveled up the ureters and up the kidneys and just damaged the glomeruli, if I can pronounce that right. But yeah,
You're doing it right, bro.
I've seen it. I think I want to say like once or twice. I want to say once for sure. I can remember second time. I'm not sure it was the same patient or not. But they had it, and they had a really bad UTI, and it backed up all the way to these glomeruli. Bad stuff.
Yeah, I only seen it a handful of times. The last one was probably in LaGrange, which was my first staff job, and that was 4 years ago. Another problem with kidneys, which causes issues, is kidney stones, and they occur where too much calcium is absorbed from foods that cause obstruction or dehydration, and it's just a waste product of the functioning of the kidney. Eventually just gets clotted into this. You could also have different types of kidney stones. One could be the calcium deposits. The other one could be from a buildup of urea. If you are taking a lot of foods that have uric acid, such as dates, eggs, if you're consuming a lot of alcohol and that leads to dehydration, your uric acid levels will be high. Some of those people, I remember family members that had them, is like their joints are going to start hurting. So that's the buildup of uric acid. So you could have a kidney stone from those two things. Normally, it passes on its own, super damn painful. You're going to have flank pain, and it's going to pass through. But if it doesn't...
It'll pass through.
But I hopefully
hopefully
the little rock gets through the ureters there and doesn't get stuck. But if it does get stuck and you feel some pain, you might need to go get a stone removal. So they do one way they do it is they do shockwave lithotripsy. So they just send shockwaves to that kidney that break down this calcium deposit, this kidney stone. And the other way, they might use a cystoscopy and a uteroscopy. So one of the cameras, the cystoscopy, looks for the stone, and the other device, the uteroscopy, removes the stone or breaks it down to smaller pieces till it passes through the passage. Some doctors will open up a stent to open it up. A urologist will, to make sure that the ureter doesn't close. I'm not sure if that's because of a spasm issue, or is it because of the damage that was there? You wanted the stent for it to be in there for a few days to remain open. That is out of my scope of practice here.
Yeah, I can't say so myself. I'm not 100% sure on that one.
I didn't look into to surgeries before this show.
Haven't completed that. Haven't done that in the clinical field yet.
Yeah, soon to be, with the way they pass and delegate tasks, right? The other thing that might happen is if that operation fails, maybe the kidney stone is not in the ureter, it's in the kidney, it's too large to pass through. They might use something called a percutaneous nephrolithotomy. The surgeon is going to directly make an otomy, right, into the kidney, and they're going to be able to remove the stone or use a laser to break it down into smaller pieces and extract that out of the kidney.
Polycystic kidney disease is also something you might hear around on the unit, or even for yourself or some family members. It's kind of similar to when you think of polycystic ovarian syndrome, where the ovaries have different amount of cysts on them. Same concept here. It's characterized by the formation of kidney cysts that enlarge over time and may cause serious kidney damage and even kidney failure. Individual cysts can be fairly common and usually harmless. Some symptoms may include back or flank pain, increased abdominal size, blood in urine, and high blood pressure. So if you probably look at my kidneys and Matt's, one of us might have like a cyst here and there on our kidneys, which is going to be completely benign. It's just those things that happen. Same way you might have cysts somewhere else in your body that might not necessarily be cancerous. They're just there because they're just growths, you could say. And it just kind of is what it is. They're not really harmful until they become either too big, where they cause pressure on your kidneys or impede blood flow and circulation. In those kind of situations, you have to get those removed. And of course, they could be cancer causing if they look cancerous. But of course, you need a biopsy to get that checked out. And of course, if they're fast growing, if your doctor could see a cyst but doesn't want to test it out because they think it's normal, and growing exponentially over the next months, years of your life, that's probably a good time to get it checked out.
Yeah. UTIs, urinary tract infections, could be another reason leading to kidney problems and kidney disease. And that's bacteria infections that are going to cause an infection in any part of the urinary system. Usually it's in the urethra, or usually in the bladder, but if it travels up to the urethra and the kidneys, that could become an issue, getting nephritis and other issues. Usually you treat that with antibiotics. Rocephin is the most common one. We always get them from the ER, and that way then they switch up then antibiotics. And it's always funny getting UTI grandmas, especially when they're older, 80s. You know, as a night shift nurse, they might be a little bit combative, might need restraints, or they could be super out of it, just pleasantly confused, and it's an easy shift. So
they're always tripping.
UTIs can be a hit or miss.
Yeah. I didn't know how frequent UTIs happen until I became a nurse, because when I was growing up, nobody really ever got a UTI. Maybe my mom got one here and there, if I recall correctly, or whatever, but maybe my grandma or somebody. But in a hospital, it's like almost everybody has a UTI. Every other bed is like UTI on Rocephin, so we have an antibiotic for UTI. I'm not sure if it's because these tests are like super sensitive, where people come positive with UTI when necessarily don't have one. It's just super sensitive, and we just mark them down as UTI, just to treat it. Because I feel like people's tolerance for, I guess, bacterial growth down there, you could say, or in that area, has to be different. Some of our bodies probably have more bacteria inside than some others, and it might not be like a universal test, but it's probably it's simple and quick to do though.
Yeah, supposedly when I was younger, I heard you're supposed to drink cranberry juice, and that's benefiting UTI because it's decreasing the acid level. Could be just a myth I heard back in the day. Not sure.
Well, I think it's true, because the women I don't know the women in my family, but I don't know. I feel like I heard that somewhere too. You
know what you're trying to say.
I don't know what I say. I feel like I heard that somewhere too, but I can't recall if it's like from my aunt, my family, or is it some like women that told me that? Like, I'm not sure, but I know I've heard that as well. The same thing that maybe your grandma told me at the hospital.
I told you, you told me, and we think that's truth, and that's how false information starts.
Yeah, let us know. Do y'all think that cranberry juice prevents UTIs, or have y'all heard about that before? I've heard that many times, I feel like, for sure.
Let us know.
That's why Matt always drinks cranberry juice.
Early signs of kidney disease. You might develop poor appetite, have some dry skin. It might be very shiny, like in the shin area. Frequent urination is one of them. Fatigue, difficult concentration, and puffy eyes. So with the buildup of toxins, if your kidneys aren't properly functioning, you're going to have the buildup of toxins that causes the fatigue. You're out of it, lightheadedness, whatever the case might be. And some severe symptoms, nausea, vomiting. That could be a sign of hyperkalemia. Changes in urine output, fluid retention that's leading to edema in the feet, the ankles, the hands, and some pink dark urine, which means hematuria. So depending on where you are with those symptoms, it could either be very severe, or you might be a kidney disease patient already that missed a couple of treatments. They're hyperkalemic, they're completely fatigued, and they need a stat dialysis, and they come to the ICU.
So you may be thinking, hey, with all these signs and symptoms that you might be having that we just listed, maybe you're thinking, hey, how do you find out if you have any kind of kidney disease or renal disease? There's two main tests we do in a hospital. One is the GFR, which is the glomerular filtration rate. A normal GFR is 60 or more. That's the normal range, 60 plus. If it's less than 60, you have some kind of kidney issues going on. It could be the beginning of kidney disease, or you could have an AKI, an acute kidney injury, something like that. But if your GFR is 15 or less, you're what we call in renal failure or kidney failure in other terms. And that's when you have to really, really change your lifestyles, and most likely going to get put on dialysis with either peritoneal dialysis or hemodialysis, or even possibly CRT if you're really critically ill and you're in the ICU with us. But yeah, GFR is the main factor. But I feel like in the hospital, a lot of times we look at creatinine clearance a little bit more. I feel like creatinine clearance, it's just like that. There's two main tests. I feel like a lot of doctors prefer creatinine clearance.
Creatinine is another lab value that we check for, along with the GFR, glomerular filtration rate. So normal range value is going to be 0.6 to 1.2. If you have one kidney, it might be 0.8 to 1.9. So just look out for that. And creatinine is a normal byproduct that we get from muscle wasting, from the breakdown of our muscles that we filter out. As that increases, that means your kidney function is getting worse. There's also another lab value that we check for, and that was albumin that I mentioned, the protein in the urine. So as the scarring happens in the glomerulus, you start leaking out albumin, and we could detect that. The less albumin in the urine, the better. Sometimes that might happen from UTIs and amongst other things. So just look out for the full clinical picture to see whether this is actually kidney disease or it's something else. But if you're a normal in a normal healthcare setting in a provider, you get that checked out, that's the issue, kidney disease. And the other thing is the 24-hour urine collection. I've done it a handful of times as well, where the doctor is going to assess all the urine in the past 24 hours and see what the albumin to creatinine ratio is. And if you are producing more than 30 milligrams over a gram of albumin, that is a sign of kidney disease over the past 24 hours. I always wondered about that because those basins are always left on a full of ice, and you're always pouring stuff in there. A nurse misses and forgets about it. It's always hard to collect those lab value tests. Out of all of them, it's probably one of the hardest ones.
It is. It for sure is. And it's like you think it's something so simple, but it's just like something that just gets overlooked, because it's not the most stat test you do because you have 24 hours to collect all the urine. So it's like nothing super duper stat important. You got to do it now. But it's one of those things that it kind of just goes above our head sometimes. But it is what it is.
Yeah.
I think I did it, I want to say 3 or 4 times in my career where I had to collect that.
And how to stay healthy, just to wrap everything up. So key factor here when it comes to kidney health is avoid high blood pressure. Funny, because I went to get my blood pressure checked today and I slammed the coffee. I felt like I had heart palpitations, but I was really under 130, so I was good. So
You're under 130?
I was under 130. It was like 128 over 79.
Is that considered pre-hypertensive? I don't know how to change the data.
Yeah, anything above 130, I believe. I would already be in
You sure?
stage 1.
I thought it's 120 now. It's everything above 120.
120 to 129 is considered normal.
I think they decreased it.
Okay, you could check. I'm curious. You might be right. You want to manage your blood sugar levels. As you know, sugar affects the nephrons. You want to reduce your salt intake, avoid NSAIDs, and consume a moderate protein consumption.
Real quick.
That's if you have already developed a kidney disease. You don't necessarily need to eat 30 grams of protein a meal. And if you eat more than that, it's going to lead to kidney disease. I know that's a thing that I've heard in the past when I was into nutrition, and I think that's just a pseudo fact. It's a myth.
Pseudoscience. Got him. Another one solved by a couple nurses in the gang.
Hell yeah.
So referring back to that blood pressure thing, so prehypertension is defined as a systolic pressure from 120 to 139 millimeters of mercury.
120 to 130 pre?
Yeah.
That's silly. But I because 120 used to be normal.
It used to be, bro.
But I understand why they
Times
did that.
have changed, man.
Yeah, they did that because there's so many people that are pre-hypertensive, not taken care of, getting strokes, getting heart attacks. I consider myself a healthy human. Other things you should do.
With a high BMI and prehypertension.
Yeah, technically I'm Bill, that's why.
That's the thing. Like on paper, if you look at someone's chart, it almost seems like they're decent healthy, but they could do a little bit better. But then you actually look at the whole person as like they present themselves, you're just like, yeah, I mean they look different than what these labs say. So they the holistic approach, guys.
Precision nutrition and precision health is so important, and that's why reductionism and the reductionist theory is such a bad idea that has been influenced in healthcare, thinking it solves all the problems. Reductionism, long story short, is just putting things all into a box and putting all humans into one. So bacteria is bad, infections are bad. We developed antibiotics, and then we said, let's just kill everything. Bacteria is bad. That was reductionist thinking all bacteria is the same. Then we found out that it creates dysbiosis because it kills also the good bacteria. And hey, now we can't have reductionist approach to antibiotics. Now we have to pick which antibiotics and whether they're good because we created super infections. That's one thing. The vaccines is another thing, another conversation.
Another day, another episode.
Another episode if you still are tuning in and listening to us. So things everyone should do for healthy kidneys is exercise, controlling your weight, follow a balanced diet, quit smoking if you are, drink in moderation because it leads to dehydration, stay hydrated, monitor cholesterol levels, and get annual physicals. That's more for the older audience that could have issues with kidney function. Normally, as a young person, you are not going to have this, but educate your family members with this episode if you find value in it. I think the youngest person that I've seen with needing a transplant because his kidney disease got so bad is like 41. So depending how bad your hypertension is and what culture you are and genetics and etc.
Yeah, it's the whole holistic beings that we are. It's everything affects everything. Sometimes you get a shitty shuffle of the cards, and you have these predispositions that you maybe were born with or you live with. But regardless, the world is beautiful, and stuff just happens. And it's what it is. He's a kidney for you guys.
Okay, that's closed like that by saying the world is beautiful. I love it.
That's what I'm saying, man. The world is beautiful. Can you say it's not?
It is beautiful. I feel beautiful. If you listen to this episode after hours and are on YouTube or Spotify, I don't have any facial hair. It's the first episode I'm rolling in Cup of News without facial hair in over 3 years. This is rare.
I check him at the door. I wasn't sure who this is.
Let's go take a screenshot.
Yeah, I can't even let him watch R-rated YouTube videos anymore. One day when the pop-up comes up, are you 18 years old older? He's got to mark no.
So if there was a webcam, my TV would say no.
Yeah, it would say no.
Present your picture ID.
Yeah.
When 10 years in the past.
All right, y'all. Happy Monday. Have an amazing and beautiful day.
Take care.